Have you ever walked out of a doctor's office with more questions than answers? Maybe you felt like your concerns weren't taken seriously or worse, brushed off completely just because of your age. If you're a woman over 60, what I'm about to share could be a turning point in how you experience healthcare. In fact, it might even save your life. In today's video, we're pulling back the curtain on 5 subtle but dangerous questions that doctors often ask. On the surface, they might sound polite or even caring, but underneath, they can reveal harmful assumptions, manipulations, or even outright ageism. We're going to break down what those questions really mean, how they can affect your treatment, and most importantly, how to respond with confidence and clarity. And trust me, you'll want to stay with me until the very end because the 5th question is disturbingly common. Knowing how to handle it could be the key to protecting your independence, your dignity, and your well-being when it matters most. Before we dive in, a quick note. If you find this video helpful, please give it a thumbs up. And if you're new here, consider subscribing and tapping the bell so you never miss another important health update for women over 60. Also, I'd love to know who's watching. If you're still with me at the end, drop a number 1 in the comments to let me know you're here and learning with us. If it's not your cup of tea, that's okay too, comment 0 and tell me what I can do better next time. All right, let's begin. 1. Are you sure you want to know the results? Picture this. You're sitting in a quiet exam room. The walls are pale. There's the faint hum of fluorescent lights. You've just had some tests done, maybe a scan, some blood work, or a screening. The doctor walks in, maybe glancing at your chart, then meets your eyes with a pause, a sigh, and then says, with a soft, almost protective tone, "Are you sure you want to know the results?" Seems like a kind question, right? Like they're trying to shield you from something upsetting. But let's take a closer look. More often than not, this question isn't really about protecting your emotional well-being. It's about their discomfort, their time constraints, their hesitation to enter a difficult conversation. Because truly explaining test results, especially when they're complex or serious, takes more than medical knowledge. It takes time, care, patience, and a willingness to face uncertainty alongside the patient. And sadly, not every doctor is willing or able to do that. Some use this question as a kind of escape hatch. If they can nudge you into backing away from the details, they can move on. No need to explain that shadow on your x-ray. No need to walk you through what elevated enzymes actually mean. They can just gloss over it, reassure you vaguely, and save themselves a 20-minute conversation. But here's the hard truth when it comes to your health: ignorance is not bliss. It's a risk, a dangerous one. Because knowing sooner, having all the facts, can be the difference between a problem that's manageable and one that quietly grows into something much more serious. Let me tell you a story that illustrates this perfectly. The story of Janet. Janet was a retired school teacher, 68 years old, with a kind smile and a passion for knitting blankets for her grandchildren. When she first came to see me, she was tired, bone tired. She'd been feeling off for months. Low energy, foggy brain. She thought maybe it was just aging, or maybe she needed more iron. Her previous doctor had done a round of blood work, but when the results came in, he simply smiled and said, "Everything's probably fine. Do you really want the full breakdown?" And Janet, trusting his calm tone and medical authorities, shook her head. She didn't want to seem difficult. She figured, if it were serious, he'd tell me. 6 months passed. The fatigue worsened. She finally came for a second opinion. We pulled up her old test results, and my heart sank. Her iron levels were dangerously low. Her platelets were dropping. There were patterns in the numbers that suggested something serious, something that should have been caught much earlier. Janet had the early signs of a bone marrow disorder. Had we started treatment 6 months prior, the path forward would have been far simpler. Instead, she faced more invasive procedures and more difficult treatments, all because her first doctor didn't take the time, or worse, didn't think she needed the truth. Janet's story isn't unique. In fact, research shows that up to 20% of serious diagnoses are delayed due to poor communication or withheld information, especially in older patients. And yes, especially in women. Because too often there's an unspoken assumption in medicine: you're older. You probably don't want to deal with this. Let's not burden you. But you're not fragile. You're not a burden. You are a person with agency, and you deserve to know the full picture of your health, no matter how complex, no matter how uncomfortable the conversation may be. So what do you do if a doctor asks, "Are you sure you want to know the results?" Here's your script. Say calmly but firmly, "Yes, I want to know everything." Please walk me through each part of the results and explain what it means for my health. Bring a notebook or, if allowed, record the conversation on your phone so you can review it later. Ask clear, specific questions. What do these numbers mean? Are they within normal range for my age? What's the next step? And what are my options? And if you sense evasion, don't back down. Politely request a follow-up appointment or get a second opinion. That extra step could make all the difference in your outcome. Remember, you are not asking for a favor. You are advocating for your right to be informed, to be respected, to be seen. Because staying silent in the face of subtle dismissal doesn't make you a good patient, and it makes you vulnerable. If you're still watching and found this story meaningful, type 1 in the comments, so I know you're here with me. It truly means a lot. And now, let's move on to the second question, which might sound like a suggestion, but could actually be a quiet attempt to dismiss your future entirely. Coming up. Do you really want to go through all that at your age? So, as we saw with Janet, sometimes a single question can steer your entire care journey in the wrong direction. And the next question we're about to uncover might sound gentle, but it can chip away at your confidence and make you second-guess your right to pursue the life you deserve. Let's take a look at this one. 2. Do you really want to go through all that at your age? At first glance, it may sound like a reasonable concern, maybe even a considerate question, but listen closely. That sentence isn't really about you. It's not asking how you feel what you want or whether you're capable. It's loaded with judgment, wrapped in a thin veneer of kindness, but dripping with quiet condescension. When a doctor leans forward and asks, do you really want to go through all that at your age? They're not asking about your individual strength or determination. They're not evaluating your actual health status, energy level, or potential to recover. Instead, they're making a snap judgment based solely on how many birthdays you've had. That, my friend, is medical ageism in its purest and most dangerous form. And unfortunately, it's far more common than many people realize. In my decades as a physician, I've seen how that single question, subtle as it may be, can plant seeds of doubt. It erodes confidence. It makes patients question their own worth. It convinces people that maybe they don't deserve to get better. Maybe they're too old to hope for more. Let me show you what I mean. The story of Margaret. Margaret was 72 when I met her. She was the definition of vibrant. Every morning, she walked 2 miles through her neighborhood with a small group of friends. She kept a lush vegetable garden that would put most farmers to shame. And once a week, she hosted a book club in her sunlit living room where laughter and conversation flowed like warm tea. But underneath all that energy, Margaret was hurting. She had severe knee arthritis. Every step became more painful. The garden became harder to tend. Sitting for long periods during book club left her stiff and wincing. She had tried medications, physical therapy, and even cortisone shots, but the pain kept creeping back. So, like many proactive patients, she went to consult an orthopedic surgeon about a knee replacement. A solution was within reach. But instead of being met with support and a detailed discussion about the procedure's pros and cons, Margaret was met with a slow sigh and the question, do you really want to go through all that at your age? That was it. No discussion of the procedure's safety, no breakdown of the success rates, no encouragement to make an informed decision. Just a 5-second dismissal wrapped in polite doubt. Margaret left the appointment confused, not because of the pain in her knee, but because of the pain in her heart. She came to me a few weeks later hesitant and disheartened, not because she feared surgery, but because someone made her feel like she didn't deserve relief. Like her suffering was just something she had to accept now. Was she too old to fix her knee? Was it selfish to want to walk pain-free again? Should she just settle because of a number on a chart? I was furious, because here's the truth. Margaret was an ideal candidate for surgery. Her heart was strong. Her blood pressure was under control. She exercised daily. Her lifestyle and attitude made her recovery odds better than some patients in their 50s. And yet that one question had nearly robbed her of the chance to reclaim her quality of life. We sat down together side by side and I walked her through the real facts. Recent studies show that knee replacements in healthy older adults, especially those who stay active, can lead to significant improvements in pain and mobility. In fact, more than 80% of patients report increased satisfaction with daily life after the procedure. Many even return to activities they hadn't enjoyed in years. Armed with that knowledge, Margaret made the decision for herself. And just 6 months after the operation, she was back to her morning walks. Not just walking, but beaming, proud, pain-free. Back in her garden, back at book club, living, not just existing. That story isn't rare. And that question, it's not just frustrating, it's harmful. According to research from the National Institute on Aging, older adults who face medical ageism are less likely to pursue treatment, stick to prescribed care plans, or even return for follow-ups. And why? Because they've internalized the idea that it's too late for them, that maybe their health just doesn't matter as much anymore. That's a tragedy we can and must prevent. Too many doctors operate from unconscious bias. They assume your best years are behind you. That being over 70 means slowing down, being over 75 means settling, and being over 80, why even try? But here's what you know. Your age does not define your potential. It doesn't define your dreams, your grit, or your ability to heal. You are more than a number on a chart. So if you ever hear that question, if someone dares to ask, do you really want to go through all that? At your age, I want you to stop them right there. Take a breath. Then say clearly and firmly, yes, I do want to go through this because I value my health and my future. Let's talk about my actual condition, not just my birth date. Push for specifics. Ask, what are the success rates for this procedure in patients like me? How will this treatment affect my daily life? What's the evidence behind your recommendation? And if the doctor can't or won't give you real evidence-based answers, then it's time to find a new doctor. One who sees you as a full human being, not a burden, not a statistic, but a person with value, with goals, and with a future worth investing in. Let me remind you again, you deserve to live well, not just survive. And now let's look at the third question, which might sound philosophical on the surface, but can quietly lead you down a path of passive neglect, especially if no one is there to advocate for your care. Coming up next, have you considered just letting nature take its course? Don't go anywhere, because this one cuts even deeper than you might think. So what happened to Eleanor after she chose surgery? She didn't just recover, she thrived. 5 years later, she's still going strong, laughing with friends over bridge games and teaching them a trick or two. Her story is a reminder, when older women are respected, informed, and supported, they don't just survive, they shine. But Eleanor's case is far from rare or solved, because across the country there's a silent pattern at play, one that the data confirms. According to the American Cancer Society, older women are significantly less likely to receive aggressive treatments for breast cancer, even when they're otherwise healthy, active, and strong enough to benefit. Why? It often comes down to one softly spoken phrase, a phrase that sounds compassionate, even philosophical on the surface. Maybe it's time to let nature take its course. Sounds gentle, doesn't it? Like a doctor offering a peaceful perspective. But behind that calm delivery often lies something more insidious: reluctance. A hesitation to invest time, effort, or resources into a patient they've quietly written off. And when that happens, it's more than just a moment of bias. It's a betrayal of trust, a slow erasure of your right to choose. Because while it is your right to refuse treatment, that decision should come from a place of information, not from a doctor's resignation assumptions or sugar-coated fatalism. If you ever hear those words, let nature take its course, don't smile and nod out of politeness. Don't assume they're saying it because it's your best option. Pause, take a breath, and ask the questions that matter. Are you saying there are no viable treatments left? What would your recommendation be if I were 50? Is this advice based on evidence or just on how old I am? These questions put the responsibility where it belongs, on the doctor, to explain, to clarify, and to be honest about whether their recommendation is grounded in science or tainted by bias. And if they stumble, backpedal, or can't provide clear answers backed by data, don't hesitate. Seek a second opinion immediately. You have every right to explore your options, to ask questions, to understand the risks, the benefits, and the possible outcomes. And if one doctor isn't willing to walk that path with you, another one will. Let's be clear, wanting comfort, choosing not to pursue aggressive treatment, and allowing nature to take its course, these are valid decisions, but only when they are yours to make, and only when made with full understanding of your medical reality. The quiet coercion of age-based recommendations robs you of that choice. It isn't care, it's control. You are the one who should decide how your story continues. Not based on someone else's assumption about your age, but based on your own values, hopes, and health. Speaking of assumptions, the next question is often masked as routine. But it can carry deeper implications that follow you long after the exam is over. Let's talk about a seemingly simple inquiry. Who's making your medical decisions for you? At first glance, that question might seem standard. Maybe you're at the clinic with your spouse, daughter, or caregiver. The doctor might be trying to clarify who helps you manage your care. That's fair, right? Well, maybe not. Because depending on how that question is asked and the assumptions behind it, it can actually reveal far more about the doctor's mindset than your own. When a physician asks, "Who's making your medical decisions for you?" there are often two troubling possibilities at play. One, they're quietly testing your mental sharpness without telling you. Two, they're looking for someone else to defer to because they don't fully trust you to lead the conversation. Both situations are problematic. Both can affect your care in ways you may not see coming. Let's break that down. 1. A hidden cognitive test. In many cases, the doctor isn't asking because there's a clear concern. Instead, they might be casually and unfairly testing your memory, your recall, your sharpness. And they do it under the radar. Maybe you pause for a second when trying to remember a medication, or you defer to your family member for a date or dosage. These tiny moments, common and perfectly human, can trigger assumptions. Instead of using proper assessments, like the mini mental state exam or the Montreal Cognitive Assessment, which are scientifically designed to measure cognition, they jump to conclusions. Maybe she's not fully capable. It's lazy, it's inaccurate, and it's dangerous. 2. Disrespecting your autonomy. The second issue runs even deeper. By asking who's making your decisions, especially in the presence of family, they may be looking for someone to redirect their attention to. Someone they believe is more reliable, more decisive, someone younger. And when that shift happens, you can literally feel the power leave your hands. You're no longer the one being spoken to. You're being spoken around. This happens especially often to older women who are wrongly assumed to be passive or uncertain. And the result, your voice gets sidelined in your own care. Let me tell you about a moment I'll never forget. Eleanor was 76, independent, sharp, full of life. She still handled her own bills, managed all her medications, and hosted Sunday dinners for a big, noisy family. She wasn't just active, she was the one holding her family together. One winter afternoon, she came in for a routine checkup, accompanied by her daughter, who had driven her in because of the icy roads. During the appointment, the doctor asked about her blood pressure medication. Eleanor paused for just a moment, trying to remember the exact dosage. That was all it took. The doctor turned away from Eleanor and directed his next question to her daughter. "So, do you usually help her make her medical decisions?" And just like that, Eleanor was no longer the patient. She was a bystander. The rest of the appointment was a blur. The doctor addressed her daughter, directly ignored Eleanor's responses, and even cut her off when she tried to mention a new symptom. By the end, Eleanor felt humiliated. Not because she forgot a number, but because she'd been reduced, diminished, and visible in her own care. Now here's the part most people never realize. That moment of doubt, that one assumption. It doesn't end when the appointment does, because doctors often record their impressions in your medical chart. And those impressions can have ripple effects for years. Notes like, cognitive concerns noted, may require assistance with decision-making, dependent on family input, can quietly show up in your file without your knowledge or consent. And those vague, unverified notes, they follow you. They can impact how future doctors treat you. They can affect your access to procedures, your eligibility for certain medications, even how your insurance provider classifies your needs. In serious cases, they might influence decisions around legal guardianship or your ability to live independently. A 2023 study published in the Journal of the American Geriatric Society found that up to 15% of older adults had unsubstantiated notes suggesting cognitive decline in their records notes that led to treatment restrictions or unnecessary referrals. Coming up next, what if you really do need some support with decision-making? How can you make sure it's handled with respect, not assumptions? Stay with me. We're about to talk about the fine line between helpful support and harmful overreach. And if you're still watching and finding this video valuable, please comment number 1 below. Your feedback helps me know you're with me and helps others find this important message too. Earlier, we talked about how your medical autonomy can quietly be questioned even when there's no real cause. Now, let's take a closer look at one of the most common and most misleading ways that this can show up during a doctor's visit. Sometimes, due to dementia or cognitive concerns, it is necessary to have a conversation about medical decision making. But that conversation must be grounded in respect, clarity, and actual clinical evaluation. It should never begin just because someone paused during a sentence, has gray hair, or is accompanied by a family member. Unfortunately, ageist assumptions still shape too many of these interactions, and women bear the brunt of it. Studies show that older women are significantly more likely than men to have their ability to make medical decisions questioned, even when there's no cognitive decline at all. That's not just unfair, it's unacceptable. So, what should you do if you're in this situation? If a doctor unexpectedly questions your decision making ability, take the lead immediately. Speak with calm confidence and say something like, I make my own medical decisions, but I welcome input from my family. Is there a specific reason you're asking? That one sentence does two important things. It reaffirms your authority and it invites transparency. If the doctor continues addressing your family members instead of you, call it out directly. I'd prefer you speak directly to me. I'm the one making decisions about my health. After the appointment, be proactive. Ask for a copy of your medical records and review the notes. If you find anything inaccurate or concerning, request corrections in writing. If the doctor repeatedly undermines your role, it may be time to find a provider who respects you fully. Remember, you are the driver of your healthcare. No one else should take the wheel without your permission. Speaking of driving, here's another loaded question you may hear. Are you still driving? At first glance, it might sound like casual small talk. After all, driving is a routine part of life. And yes, there are legitimate reasons a doctor may need to ask, especially if you're living with conditions like epilepsy or severe vision loss. But the problem isn't the question itself, it's the context and timing. If you're visiting the doctor about something unrelated, say a skin rash, joint, pain, or blood pressure management, and they suddenly ask, are you still driving? It's worth pausing. Because more often than not, this isn't really about your driving at all. It's a covert way to assess your independence or cognitive health without telling you that's what's happening. It's an unofficial test one you never signed up for, and the results can follow you far beyond the exam room. Doctors may interpret your answer through their own biases. Say yes. They might write patient still drives. May not be aware of limitations. Say no. They could jot down loss of independence, monitor for decline. Either way, your response could be twisted to support a narrative of frailty, all without any formal cognitive testing. This type of quiet judgment tends to fall hardest on older adults, especially women. Let me share a real story. Claire, an 80-year-old woman, came to see me after a routine checkup, left her rattled. She was active, sharp, and handled her finances with ease. During a discussion about arthritis medication, her doctor casually asked, "Are you still driving?" Claire responded that she drove during the day but avoided driving at night due to glare from headlights, a smart and thoughtful choice. The doctor didn't comment further. But days later, Clara received a call from her insurance provider. A note had been added to her chart. Surprise patient still drives. Monitor for cognitive issues. Surprise based on what? Her age, her glasses, her decision to avoid night driving. That one innocent-sounding question snowballed into a required and expensive driving evaluation she didn't need, all from a note based on an assumption without any clinical evidence. And Clara's experience isn't unique. A 2022 report from the American Medical Association found that older adults, especially women over 75, face disproportionate scrutiny over driving. These kinds of notes can trigger real consequences, alerts to the DMV license restrictions, even discussions about guardianship. All of this can happen without any formal diagnosis or cognitive assessment. In some states, a single note from your doctor can force you into a mandatory driving test, even if that note is rooted in nothing more than bias or speculation. But the deeper issue goes beyond driving. It's what this question represents, a quiet, creeping idea that aging equals decline, that your independence is slipping just because of your age. And once that idea makes its way into your medical records, it can quietly chip away at your freedom. Because driving isn't just about cars and errands, it's about autonomy. And questioning it without cause feels like someone's questioning your very right to live on your own terms. So how should you respond if you hear this question? Be clear. Be assertive. Say, yes, I drive and I feel fully confident in my ability. Is there a medical reason you're asking? If you don't drive, explain it on your own terms. I choose not to drive because I prefer public transit, but I'm completely independent in my day-to-day life. Then follow up. Will this be noted in my chart, and if so, how? Request a copy of your visit notes and correct any misleading statements right away. If the doctor's tone or questions feel condescending, trust your instincts. You deserve a provider who sees you for who you are, not through the lens of ageist stereotypes. Because your independence isn't a suggestion, it's yours. And no one should be allowed to take that away with a simple, offhand question. So tell me, have you ever been asked one of these questions at the doctor's office? How did you respond? Your story might help someone else find their voice, so don't hesitate to share it in the comments below. If this video opened your eyes or made you feel just a little more prepared for your next visit, please like this video, share it with a friend, and subscribe for more practical tips and empowering insights. You deserve to be seen, heard, and respected in every conversation about your health. We're here to help make sure of that, one video at a time.